I'm Dr. Benjamin Busfield. I practice in the East Bay. I'm an orthopedic surgeon. An orthopedic surgeon is a bone and joint doctor. We deal with diseases of the joints, as well as the bones and soft tissues. Most people don't know what an orthopedic surgeon does. We do not always operate. There's a large portion that's non-operative as well, both in young athletes as well as older patients. That includes a spectrum of arthritis, tendon injuries, meniscus injuries, and broken bones. As a general orthopedist with a sports medicine emphasis, I treat a large area of orthopedics, excluding the neck and back. I've done a sports medicine fellowship at Kerlan Jobe Orthopedic Clinic in Los Angeles. A sports medicine fellowship is an extra year of training after your orthopedic residency to specialize in arthroscopic surgery and sports medicine. I trained at UC San Francisco for my residency, and I was raised here in the East Bay and attended college at UC Davis. My offices are throughout the East Bay, making it easier for patients to see me. Rather than traveling to see me, I come to see them with my various offices. Arthroscopic surgery involves the use of an arthroscope to do minimally invasive surgery. That is an emphasis of what I do. That's part of sports medicine training. I use that to treat disorders of the shoulder, hip, knee, and ankle, as well as occasionally the elbow. That involves using a scope to make minimal incisions, causing minimal post-operative pain, and achieving what we couldn't do previously. In the past, large open incisions were used that would cause more pain and slower rehabilitation. With sports medicine now evolving into these arthroscopic treatment options, the pain and recovery is much decreased. Arthritis involves the loss of cartilage around a joint. A joint is where two bones come together to allow movement. The common areas of arthritis would be the shoulder, knee, and hip. Typically in older patients, although it can be in younger patients after having had injuries. Arthritis involves pain, stiffness, and limited function and motion. Treatment options are always surgical and non-surgical options. Surgical options would include, at the most aggressive form, replacing the joint. Non-operative care would involve use of pain medications or anti-inflammatories, as well as injections. There are two types of injections, steroid and local anesthetic injections, as well as another injection called gel injection or viscosupplementation. Those are all efforts to decrease the pain without having to replace the joint. A joint replacement involves removing all the arthritic cartilage and a little bit of the bone underneath and replacing it with a metal and plastic prosthesis. This allows return of motion, decreased pain, and hopefully return to an active lifestyle. To see me as a patient, if you have typical insurance that is an HMO, you will need a primary care doctor referral in writing to have that happen. For a PPO or with Medicare, you can refer yourself to my clinic by calling our number for a visitation or evaluation. I also do second opinions. This is a typical office that I would work in. This is an examination table I would examine the patient on. I typically offer non-operative treatments before operative treatments whenever possible. Surgery is a very powerful tool, but it also comes with complications. Knowing when to use it appropriately is key, and that's part of my training and expertise in orthopedics and sports medicine. I also treat workers' compensation injuries. Workers' compensation is a difficult process to navigate for the average patient. Workers' compensation is a no-fault insurance program offered through your work, and you establish that claim when you're injured at work by filing paperwork with your HR department or through your job. Once accepted as a claim, I see workers' compensation patients, which is a separate insurance form, and it enables you to seek care and hopefully get you back to work as fast as possible. It is important that you establish the paper relationship for workers' compensation prior to seeking care, because that establishes the claim as being workers' compensation. The appropriate time to see me as a patient really is based on the injury or your complaint. If there's been a traumatic injury or at the most extreme a broken bone, you should really see an orthopedist ideally within a week of the injury. If you're not getting better with non-operative care offered by your primary care doctor, be it anti-inflammatories, pain medication, or physical therapy, that's worth a referral to see if you've had an injury that's not been appreciated. Liberal use of an MRI is not typically the answer. We can usually find out the reason for the injury by examination, and we use an MRI to confirm what we think is the injury. It's not uncommon for patients to come to me asking for MRIs, which many times is not appropriate. Much can be learned from x-rays and examination, and that's the reason to see me as a patient. As a specialist in sports medicine and orthopedic surgery, I have an additional qualification board certification, if you will, in sports medicine as well as orthopedic surgery, and I've done the extra year of fellowship training in sports medicine. That enables me to give really expert care that is not commonly available in the East Bay area. There are very few doctors with my qualifications. My goal is to give patient-centered care, not to rush to surgery, and really meet the patient's needs with the treatment options. I am very conservative with care, especially with surgery. I would only do that typically as a last resort when everything else has failed. So really, I feel that my job is to get the patient back to function and even athletic activities without having to have invasive treatment if possible. The best part of my job is returning a patient to their active lifestyle with or without surgery is very rewarding to me, because I think that's the hardest thing to do, especially in an active athlete. To get them back to function without having any pain is very rewarding, and is one of the benefits of having my job.